Hello, my name is Eileen. I am your orthopedic nurse. My job here at St. Joe's is to get you prepared for your surgery. The video that you're going to watch is going to explain what happens before you come for your surgery, during your stay here for your surgery, and what happens after you are discharged. You will also receive a call from one of us regarding joint camp. During this joint camp, we are going to go over equipment used, answer any and all questions that you may have, plus explain what happens from the time that you are booked for your surgery until you're discharged. We want your experience here at St. Joe's to be an excellent one. We strive for that here, and we hope that you will have a pleasant experience. Hi, this is Eileen again, and my job as a nurse navigator is to get health information on you. Please have available when I call your medication list, your dose, and how many times a day you take them. Please have your allergy list and a list of all your surgeries that you've had to make your telephone interview go more smoothly. Right now I'm standing in the pre-op area that you'll be admitted to after the greeter admits you. This is all the equipment that the pre-op nurses will need to make your experience before surgery go more effectively.
Hello, I'm Becky. You can expect to stay up to 3 nights in the hospital after your surgery. You will be in a private room, much like this one. We will be checking on you frequently, day and night, to ensure that you remain stable during your stay. There are a few key things the nursing staff will be working with you on while you're here. The first thing that we need to do is manage your pain. If you're having a lot of pain, you aren't going to be able to do the things that we're going to need you to do. On the day of surgery, we'll most likely be giving you medication through your IV, and we will change to pills as soon as we're able to, because that's what you'll be going home on. We'll be working with you to find the medication that works best for you and how often you'll need it to stay comfortable. We will ask that you use a call bell to ring whenever you're having pain or if you need anything else. The next thing that we'll be working with you on is preventing blood clots. There are 2 things that we'll be doing. One is to be putting a device on your legs that acts much like a blood pressure cuff. It inflates and deflates and promotes good blood flow and prevents blood clots. The second thing we'll be doing is giving you medication that the surgeon will order on the day of your surgery. We'll start it here in the hospital, and it will continue when you go home. We will help you understand that medication so that when you go home you'll know how and when to take it. The final thing that we'll be working with you on is preventing pneumonia. We will be asking you to get out of bed and walk. The staff will be assisting you with this, both nursing and physical therapy. We will also be using a device called an incentive spirometer if we have an physician's order for that, and that encourages deep breathing and expanding your lungs. If that is not ordered, we will at least be asking you to take frequent deep breaths. We will be asking you to do this several times during the day and also at night when you're awake.
Hello, my name is Jean. I'm a physical therapy assistant, and I'm just going to talk about what to expect from physical and occupational therapy while you're here during your stay. A physical therapist will come and evaluate you day of surgery. They'll be coming into your room and asking you a few questions, such as, how is your home set up? Will there be anybody to assist you when you go home? And if you have any equipment at home, such as a rolling walker or a pair of crutches. Part of the physical therapy evaluation is doing a functional mobility assessment. That consists of bed mobility. But prior to getting you out of bed, we want to make sure that you're safe. The surgical leg could be weak, so we'll use a knee immobilizer. This will prevent your knee from buckling when we're walking. Now that you have your knee immobilizer on, you're ready to get up out of bed and moving. We start everyone off with a front wheel walker, and then we will progress you to crutches if appropriate. Also, you will have an exercise program that you will be performing twice a day. The exercise program you will find in your packets. You will see physical therapy twice a day. If deemed necessary, you will have occupational come the next day and give you an evaluation also. Occupational therapy will be showing you how to get in and out of your car when you're ready for discharge from the hospital. Another piece that occupational therapy does is bathing and dressing. One thing that they can do is give you a piece of written handout from suppliers around the area that can give you some equipment if needed. They will also be showing you how to use some equipment for your activities of daily living that can help with your bathing and your dressing. Another thing that they can tell you about is how to make adaptations to your home, whether it be your toilet or your shower, so that you can get around your home safely. The physical and occupational therapy team communicate closely with the nursing staff to make sure that your pain is well controlled before our sessions. To maximize your safety, we don a gait belt with every patient before we get them out of bed.
Hello, my name is Sister Barbara. The goal at Discharge is to go home. This will happen rather quickly. Arrangements need to be made in advance for transportation. Ambulances are not an option, and insurances will not pay for an ambulance transport. Therefore, you need to make arrangements with your family, friends, or relatives. You also need to be sure that you have the appropriate vehicle. No high vehicles that you need to climb into, or a low vehicle that leads you to believe you might be sitting on the ground. Remember, you just had a joint replacement. You need time for it to heal, and you do not want to strain or have any compressions or dislocations to it. Another important aspect is insurance. When you come to the hospital, please bring a copy of your insurance card as well as a photo ID. We need your full legal name and date of birth in order to have our records correct. Insurance also plays an important part when you are ready to go to a rehab facility. Insurance companies will review your case and authorize your stay in the rehab facility. If they do not do so, the facility will not accept you. Insurance also plays a part in medications if you may need to use them when you go home. When you go home, you may continue your rehab by using an outpatient physical therapy service or a home health service that will send a therapist into your home. These services also need to be approved by your insurance company. To help facilitate your discharge, we also ask that you visit a local rehab facility if you think you will need their services. Ask what they can do for you after your discharge to make your life more independent. A list of these facilities will also be provided to you.
Hi, this is Eileen again. I hope you've enjoyed this video explaining what will happen during your process here at St. Joe's for your joint replacement. We know this was a lot of information, but we encourage you to please look at your joint camp book, replacement book that you receive at the surgeon's office. Also, we encourage you to plan on coming to see us at our joint camp. We have a lot of information to offer, and we want you to have the best experience here at St. Joseph's Hospital as possible. We also have, during your discharge planning here at the hospital, a program that's called Follow My Health, and we'll be talking more about that with you during your stay here at the hospital. If you have any questions, please feel free to give me a call. Again, my name is Eileen, and you can reach me at 907-1113.